On AM 1230 WJOB on 104.7 FM. I'm Jim Dedelow, and we are, of course, smack dab in the middle of the coronavirus pandemic, and all sorts of adjustments are being made all around the Calumet region. Of course, here at the studios, I'm the only one. We did that out of an abundance of precaution and our abundance of caution, and part of that is normally you would have the City of East Chicago show going on your video right now, and that is not the case on Facebook Live, but you could go right now onto the WJOB Network app on your phone, WJOBnetwork.com. You can even go into your living room, and in your living room you can watch on Amazon, Apple, and Roku. Where you can't watch right now live is on Facebook. We hope to upload this video where many of you will be able to see it in East Chicago in just a little bit. But for now, Facebook is just overloaded and we can't get to it. But we're making the best, doing the best that we can. And one of the folks doing the best that they can is the City of East Chicago to deal with what's going on here. So this is some crucial information for anybody in EC, or actually all the way around the region. Part of it is we have Dr. Gerri Browning, and he is the health commissioner in East Chicago. Doctor, thanks for calling in today.
Oh, you're welcome. Good morning.
Good morning. I'm going to ask you to talk up just a little bit. So how you doing again? I want to adjust your audio if you can.
Oh, I'm doing well. How are you?
All right, there you go. Much better. Doc, first of all, what do you do for the City of East Chicago?
Well, I'm the health officer for the East Chicago Health Department. I've been serving in that appointed position for the past 8 years, and my main function is to add health expertise in the day-to-day operations of the health department.
So right now, just doctor, in just your general comments about how the coronavirus pandemic is affecting the City of East Chicago.
Well, I think that we are one of the typical places where so far we have not been overloaded with documented cases. I think at this point there are approximately about 31 or so cases in Lake County, and the most recent data is not showing that East Chicago is a hotspot by any means. Part of the problem, of course, you can imagine, is that we don't have a lot of testing going on in our city. However, I think that with the city administration and the health department, we got out front on this coronavirus thing and decided to be proactive and promote a lot of hand washing, social distancing, sanitizing, cleaning of workspaces, and things of that nature. And thus far, I think that's playing a role as well in this epidemic.
Now, what do you want to tell the people of East Chicago that you went through a few, washing your hands. What if someone has symptoms and they're an East Chicago resident? What do you want them to do?
Well, I think that because the testing is still very limited, it's been primarily limited to those who are at the highest risk. In other words, if you've been become sick enough to be admitted to the hospital, our local hospital being St. Catherine Hospital, or if you're a healthcare worker and you develop symptoms, or unfortunately, people who are residing in extended care or nursing facilities, they are also at high risk. And so those are the people who are on the top priority in terms of testing. For the most part, if you develop symptoms like fever, cough, some low level of difficulty breathing, you might be advised to stay at home. If your breathing became more extenuated or more difficult, you'd be advised to call your primary care physician or the hospital emergency room or the East Chicago Health Department or urgent care. In other words, you'd need to seek medical advice on what to do next. But obviously, if you have an urgent or emergent situation at home, you'd go ahead and call 911 all the time, planning to inform them of your symptoms. But for the most part, most people will survive these symptoms, and it's not being advised that they immediately go to the emergency room at all. So we're being advised if you develop symptoms, stay at home, do supportive care. If you have a fever, take acetaminophen. If you have a cough, use a cough syrup. If you feel dehydrated, drink plenty of water and rest.
We're talking to Dr. Gerri Browning, and he is the health officer for the city of East Chicago. Doctor, there's a lot of trails, there's a lot of outdoor activities going on in East Chicago. What do you want to tell people who are going to get out and enjoy all of the amenities in the fine city?
Well, right now we're currently under a stay-at-home advisory from the governor and for the entire state of Indiana. And so starting this past Monday, the 23rd of March, for 2 weeks, we've been advised that unless you're going to work and doing other essential business, work related mostly, you should stay at home. I think that it's a reasonable thing to get out perhaps in your own backyard and do some exercising, walking, outdoor activity. I think that we're uncertain how many people you will encounter along the way. We're really trying to tamp down this virus and prevent its spread. So any chance that encounter can be an additional opportunity for you to either transmit or receive that virus from someone. So I'm not advising people to go out and use the trails and parks at this current time.
So what should they do?
I think that you should exercise at home, exercise in your backyard, perhaps walk back and forth in your front yard, but we need to stay in right now. The fewer encounters you have with other people outside of your family, that is, whoever's living in the home with you, the less of a chance you have of contracting, or if you have already contracted this virus, the less of a chance you have of spreading it.
All right. Anything else, Doc, that you want to tell people what's going on here in East Chicago concerning the coronavirus?
Well, I think that what we should be always aware that East Chicago is a very diverse city. It has a large African American and Hispanic population. And with those populations, there are always health disparities. And by that, I mean that a number of people in those ethnic groups often are not getting the primary care, health care that they are required to get. And therefore, the diseases that seem to affect everybody seem to affect these groups in a more deleterious fashion. With that in mind, if you are a high-risk individual, you've got diabetes, heart disease, hypertension, perhaps you're also suffering from chronic obstructive lung disease, or perhaps you're a cancer patient, you are at increased risk with this coronavirus, and therefore you should minimize your chances of getting it and adhere to the governor's stay-at-home advisory. Stay at home. If you're high risk, stay at home.
We're talking to Dr. Gerri Browning. If you're driving around, he is the health officer. Just one note to my folks, if you could turn off that 9 o'clock news, please, I'd appreciate it, so that it does not fire during this broadcast. Turn off the 9 o'clock news, and if you're listening and you want to text Debbie or Ryan or Sam or Tony, let them do that. Doctor, we're talking about the high-risk the community. Let's define that further, if you would, just so some people don't know if they're in it or not. Let's get a little more specific.
Well, I think that anyone who's 60 or 65 years of age and older is, by definition, in the high-risk population. I think early on when this pandemic started, it was believed that the elderly would be the most vulnerable, and that in many cases has proven to be true. However, what we're noticing as of late, that younger people are being diagnosed with coronavirus disease, and unfortunately, a few have succumbed to this virus. So this is very serious business. I can see, looking at the statistics, that we've got more than 82,000 cases in the United States already, and we've surpassed some of the other countries that were the original victims of this pandemic. And I think that so anybody can become victimized. Our healthcare workers obviously are at very high risk for becoming infected with this virus, as well as people who, again, if you have any kind of chronic medical disease like diabetes, hypertension, lupus, any immune or autoimmune disease, chronic obstructive lung disease, people who've been long-term smokers have probably developed some degree of that. People that are long-term smokers also develop heart disease. These are the people who have a bullseye target on them when it comes to this virus. Long-term asthmatics, any long-term illness, and again, I mentioned people who've been undergoing treatment for cancer, or perhaps they've completed cancer, but they're recent survivors. Their immune system is probably not 100% up to par, and therefore, they're at high risk. And of course, any patient who has HIV or AIDS also is at risk, higher risk, with this coronavirus.
There it is, Dr. Browning, EC Health Officer. It's time like this, Doc, that we're glad we got you.
Well, you're welcome.
All right, Doc, anything else you want to add?
No, I just think we should do what we have to do. Stay in, wash hands, sanitize, keep your home sanitized, stay in, only go out if you absolutely have to.
He is Doc Gerri Browning, and he is the East Chicago Health Officer. Doc, is there if anybody has any questions or anything, is there a way that they can email you, or are you any way to contact the city that you're aware of?
Yeah.
Okay, go ahead.
Well, the East Chicago Health Department, 219-391-8467.
There it is. All right, Doc, a lot of good information. I may use that elsewhere, just so you know. Okay?
All righty.
Talk to you soon. All right, Steve Segura will be up next. Steve will be calling me as soon as I text him here. And he's going to give us an update of other stuff that's going on in the city of East Chicago. As you guys well know, if you're driving around, let's do our top of the hour ID, because it is top of the hour. You're listening to AM 1230 WJOB and 104.7 FM, the voice and face of the region. You're also watching on the WJOB network, and you can get that on Amazon, Apple, and Roku on your smart TV. Just download that. And you can also, of course, get it on an app on your phone, and you can even get it at WJOBnetwork.com. The problem right now is that Facebook is not accepting certain live videos, and I got to believe that one of the things they're cutting out is commercial live video, which we are under that category. So I'm unable to connect to them live, but we will post this afterwards, and we will put it up to Facebook. So I will get Steve. If you heard there, Doc had some pretty good stuff, and one of those is just if you're outside, stay away from people. Let's see what Segura has to say. Hey, Steven, how are you, buddy?
Hey, what's up, man?
Hey,
okay, cool.
Steve, it's at times like these you're glad you have a health officer, you know?
Oh yeah, thank God. We're one of the few people in the state to still even have a health department. Thank God to the mayor, you know.
Yeah, and Doc there knows his stuff. Obviously, been around and knowing and able to quote some of the stats and stuff like that. Hey, first of all, just how is the mayor and the administration? You guys still in business?
Yeah, pretty much most of the departments are still intact. I think right now they're just kind of assessing who's essential, but almost everyone's essential to making sure the city functions, you know. So that's kind of the hard part. I mean, City Hall is closed to the public as far as them doing business, but there's still some staff paying the bills, you know. So if you need to go into City Hall, it currently is closed to city business. If you want to contact some of the departments, you can visit our website, and all our numbers are listed on there. And you can basically try to conduct some of your business via phone, you know. The building department is down there, and the water department, same thing. The lobby's closed, but you can go through the drive-through and still pay your water bill. Redevelopment, there, you know, just call the numbers. There we put the phone directory available to you, so that you can just try to still conduct business, you know.
We're talking to Steve Segura with the city of East Chicago. So you're still trying to conduct business. So most of the phone lines are being answered or not answered. I think Doc just gave out the health department. Are they going to answer that? Yes.
They are in the building. Just like I said, they're not just open to walk-ins, so if they can help you via the phone, they will try their best to help you via the phone. Same thing with all the departments that you can call in for, just to try to get assistance, you know.
Let's look forward, Steve. EC, you guys are doing a great job. You got the lakefront, you got a bunch of parks, you got Block Stadium going on, you got those big Little League fields. I mean, you got Washington Park, get over here to Kosciuszko, got all sorts of stuff going on at Central. What's going on in the future about all of these activities? You know, you got all the parade, the Mexican parade, and all that stuff. What are you guys talking about right now?
Well, right now, of course, we haven't canceled some of our later events because who knows, this may subside, you know, come summertime, you know. And if we have to scale back a little bit, we may have to, but right now, like Fusic Festo has not been canceled. A couple of our other Rhythm and Blues still hasn't, you know, Rhythm and Soul hasn't been canceled yet. But we have to kind of play this by ear, you know. If this prolongs a little bit longer, then we're going to have to make a decision, and we'll, you know, post that up as soon as we come to that road, I guess. You know what I'm saying?
Let's talk about a couple of the bigger ones just to have a good memory, okay? I mean, we need right now it's as gray as it could get outside right now. I'll put it on the camera there. And it's, we're dealing with coronavirus, but there's a lot of good things that happen over the summer. Just mention a couple of them, would you?
Oh, gosh. Of course, our biggest, most notable festival was Fusic. I mean, we had record numbers. We shut down Klein Avenue all the way to 8094 from the sheer volume of people that we had. And it was, like just jam-packed. And it was probably our best festival we've ever had in Chicago. And it's kind of where the mayor wanted to get, to bring quality events to the lakefront, and it's finally happening. But overall, most of our festivities and our festivals that we've had, even the Butterfly Fest, the Monarch Butterfly Fest, the Kielbasa Fest, we're just bringing quality events to East Chicago so that people can have something to do, A lot of that stuff, we may not have the big theaters and stuff like that, but we want fun things for families to do all year long.
There it is, Steve Segura. Steve, we got an idea that the city's still functioning at the administrative level. What about recycling, garbage, streets, all of those departments out on the streets?
Now, recycling and garbage pickup is still happening right now. I'm just going to read a quick message. All residents are respectfully asked to put their trash on Monday mornings. All trash will be picked up within a 48-hour period, with the exception of residents living in Prairie Park, Sunnyside, and Marktown. Trash collection in these areas are considered front ends, and trash should be put out on Wednesday mornings. So if you have any questions, you can call Public Works. Their number's 391-8463. If you got any hazardous materials, we ask you to call this other number, and that's 219-854-2420. And I mean hazardous materials like motor oils, car batteries, aerosols, and other, more hazardous chemicals. They will pick those up for you.
He is Steve Segura with the City of East Chicago. If you're driving around right now, we can't take your phone calls, and there's like 3 of them waiting there, Segura. So typically we don't get any, and today we got a bunch of calls. So
if they want to call our office, we'll try to help them as best we can. Our number's 391-8206, and we can help them via phone. Also, we've also put out a list of carry-out restaurants that are doing carry-out in East Chicago, and that's on our Facebook page. You can download it as well. I do have another message from Bus Transit. The East Chicago Transit will limit riders to 1 trip rotation per route. Bus riders have been asked to disembark at the location along the route or when they return to the location where they have entered the bus. Riders must comply with social distancing requirements to the greatest extent possible. This effect will go into effect on the 26th and will remain that way until further notice. So the buses are still operating. We just ask you to keep your social distancing and respect your neighbor at this point.
All right, man. Plenty of, I'm looking at the Facebook right now, summer camp, blessing of the waters, all that stuff is all in doubt right now. And touch a truck, that's actually pretty cool.
Yeah, that was going to be the first time we were going to do this, and it's kind of, I don't know, it's iffy right now. I'll tell you what has been canceled. Of course, our Easter egg hunt has been canceled. The State of the City address has been canceled. The career fair has been canceled. Earth Day has been canceled, and our Cinco de Mayo event has been canceled, and our flower show. We had a lot of things happening in April, so kind of a bummer, but safety first,
Yeah, I do know. Here, let me flash the EC TV access channel is right there. They got all these things listed right there. Mopars on the beach. The one you're really worried about, a lot of people are thinking about is right here, is August 7, 8, 9, and that's Fusic Fest. And, that's a big deal out at George Park. So, We'll find out later. You know what I mean? We can't make any predictions right now. All right, Steve. Anything else?
No, that's it. That's about it. We just, everyone, please just try to stay indoors. Wash your hands, listen to what Doc said, and we'll get through this.
You got it. Thanks a lot, Steve Segura. I'll hang up on you, and I'll finish up the East Chicago segment here. Thank you so much. All right, guys, you're going to look for this to do it later. Steve's going to share it over to the EC Facebook page, and we were unable to connect live to Facebook, and that caused us that's Facebook, and the internet is kind of crazy right now. But let me give a couple of those phone numbers. 391-8206 if you want to get to Segura and to the office. They'll try to help you out in East Chicago. And then if you want to get to the health department, it's 391-8467. That will end this live broadcast.